Welcome to the nursing tricks. Basics are the basics and you can't beat the basics. Today we have to discuss about encephalitis. So friends, in this video we have to talk about definition, causes, transmission, risk factors, diagnostic evaluation and management. इसे चमकी फीवर भी कहा जाता है. So we move to definition. An inflammation of brain parenchyma and the meninges. It affects the cerebrum, brainstem and cerebellum. ये पेरेनकाइमा और meninges जो कि ब्रेन में होती है उनको इन्फ्लेमेशन कॉज करता है. Then we move to causes. First is autoimmune disorder. Second is infection, rabies या rubeola. Third is most common virus like arbo, polio, herpes zoster, herpes simplex virus. This is the most common virus that affects encephalitis. Then we move to types. First type is primary encephalitis. The infection directly infected to the brain and spinal cord. Second is secondary encephalitis. When any secondary infection infected to the brain, that is called secondary encephalitis. Clinical manifestation, it's fever, nausea, headache, vomiting, stiffness. If central nervous system involved, then seizures, tremors, personality changes, memory impairment, amnesia and aphasia. This is the brain dysfunctioning clinical manifestation because the central nervous system involved. Then we move to diagnostic evaluation. First is blood test जिसमें कि CBC, यूरिन टेस्ट, देन माइक्रोबायोलॉजी में वायरस या बैक्टीरिया का, देन आता है हमारा CSF एनालिसिस, देन MRI, PET स्कैन, PCR, EEG and brain biopsy. Then we move to risk factors. First is children's and old age. Second is TB and HIV persons. Third is low immunity. Then we move to management. Medical management. First is diuretics. Second is corticosteroids. Third is acyclovir, which is antiviral. Fourth is anti-seizure. Then we move to nursing management. First is monitor vitals and neurological status like GCS, Glasgow Coma Scale. Second is assess level of consciousness, assess for mental status changes and personality, behavior changes. Fourth is assess for sign of increased ICP, intracranial pressure. Fifth is assess for presence of knuckle rigidity and positive kerning signs or bridging signs indicating meningeal irritation. उसको meningitis भी हो सकता है, इसलिए हम the classical sign check करेंगे, kerning sign and Bruggensi sign. Assess the client to turn, cough and deep breath frequently. Seventh is elevate the head of the bed 30 to 45 degree to effectively breathing. Administer acyclovir as prescribed. It is the drug of choice for herpes encephalitis. The ninth is initiate rehabilitation as needed for dysfunction or neurological deficit. Then 10th is assess for the muscle and neurological deficit. Then we move to prevention. Maintain hygiene and immunization. This is all about encephalitis. The most common cause is herpes zoster. This the drug of choice is herpes encephalitis is acyclovir. Then if the treatment is not followed, then it leads to paralysis or coma and death also. This is all about encephalitis.